We are asking for your help in an important change to patient care. We have come a long way at Grand River Hospital in improving care, and we keep trying to make things better. For the next while, we will show you the 6 steps in transferring care at the bedside from one provider to another. These are: get patient consent, do the patient safety check, share the situation, go over any background, do a recent assessment, and give recommendations for care for the next 60 minutes.
Just to let you know, Mrs. Smith can get a little emotional.
Before you walk into the patient's room, you may want to have a quick discussion of sensitive details with the incoming staff as you are going to the patient's room. This isn't required, but can be very helpful. Get the patient's consent before you start talking about their care.
Hi, Mrs. Smith. It's 7 o'clock and I'm going to be going home, so Sue here is going to be taking over your care.
Hi, Mrs. Smith. I'm Sue. I'll be your nurse today.
Okay.
Is it okay if we do a verbal bedside report?
Yes.
Make sure you do your patient safety check, including identifying your patient and understanding their allergies.
Mrs. Smith, can you tell us your full name and date of birth?
Dolores Penelope Smith, April 28th, 1974.
Mrs. Smith was admitted yesterday from the emergency department with an increased weakness in her legs. She is a full code with an allergy to codeine. She has an IV with normal saline running at 100 cc's per hour. She lives at home with her husband and receives some home care. Her sister is supportive and comes in quite a bit. She has a history of low blood pressure. Mrs. Smith has some pain in her right hip. She's receiving extra strength Tylenol PRN. I last gave it to her at 6 o'clock.
How's your pain now?
Much better after the medication. When do I get my next dose?
Your next medications are ordered for 10 o'clock.
Okay.
Mrs. Smith requires assistance of one to use the restroom. She's been very good about using her call bell. She is a falls risk.
Has she been seen by physio?
There is a referral made for both PT and OT to assess her today. She has a CT scheduled for 11 a.m. Mrs. Smith is looking forward to returning home, but thinks she might need a little more help. A referral to CCAC has been made. Mrs. Smith, do you have any other questions?
No, not that I can think of right now, but my sister might when she comes in.
Mrs. Smith, after report, I'd be happy to talk to you or your sister about your plans for today.
Okay, thanks.
Now that we have shared with you what a transfer of care looks like, if you have any further questions, please contact your clinical manager.